Alright, I'm checking the doctor's orders and I see this patient needs an NG tube for feeding. I'm checking for precautions. I wash my hands here. Nursing. Hi, Miss. My name is Tate. What is your name? Miss Pierce? Okay, let me check your armband here. Yep, it's all correct, and I see you're allergic to penicillin. Are you allergic to any other medications? Okay, are you taking any other medications like anticoagulant or anything else like that? No, okay. Alright, and she seems, her level of consciousness is sufficient for this, and I am going to raise her up to a working level and put her up into a, actually I'm going to wash my hands first. I'm going to slide her up to the high Fowlers. I meant to ask you earlier, but so you're having a hard time eating, is that correct? Right, okay. Alright, well that's why the doctor wants to put this tube in you. It's just going to go in through your nose, go down the back of your throat, and then into your stomach so we can help you eat. You shouldn't feel too much discomfort during this. If you do, just let me know and I'll stop. If you feel like you can't breathe or have any kind of respiratory distress, just let me know and I'll stop and I'll just pull it out and we'll figure out another alternative. Okay, so wash my hands. Put on my gloves here. I'm checking for any kind of a deviated septum. Miss Pierce, have you ever had any kind of nasal trauma or anything like that? No, okay. I'm going to check the gag reflex. Okay. Alright. I'll give you this Chuck's pad just in case you feel nauseous. Okay. What I do have to do real quick is measure from your nose to your ear, all the way down your xiphoid process, just to make sure we get the correct length. So, here we go. Okay, I'm making my mark, so we can document that later. Okay. Got you a water here. As I insert this tube through your nose and it goes down your throat here, I want you to drink. I'm going to tell you to swallow and swallow. That way the tube goes down easier and it doesn't go down to your trachea. First, I want you to lean your head back, and then I'll tell you to lean your head forward whenever it's time to do that. So, if you could, just lean your head back for a second. Alright, and lean forward a little bit and swallow, 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 and here we are. Alright, so you feeling okay? Okay. So you felt no respiratory distress, obviously, or you would have told me. I'm going to go ahead and pin this to you real quick. Then we'll check and make sure that we place it in the right spot of the tube. I'm going to insert some air in here and listen to your left upper quadrant to make sure that we got this in your stomach. Just lift up your gown here. Okay.
Oh, you're fine. Oh, no, sure.
Yep, and I hear the sounds. The bubbling. Okay, I'm also going to take out some of the gastric juice and test the pH. And it is a 2, which is in the normal range. That's what we expected. We'll also have to check the placement by radiograph. Just that's the most accurate way of us knowing that it is in the right place before we start feeding you. Okay. So now you're all comfortable. If you need anything, let me know. I'm going to lower the bed back down. Put you back in your original comfortable position. I'm going to leave the call light within reach. Okay. I'm going to leave the call light within reach. I'm going to document the time, the date, the size of the tube, the patient's tolerance of the procedure, the gastric levels that we found, which were 2, was a pH of 2, and I think that is about it. I'm going to wash my hands, the patient's down, just got the call light within reach. If you need anything, please let me know, Ms. Pierce.